Heart disease, often referred to as cardiovascular disease, is one of the leading causes of death worldwide. It includes a range of conditions affecting the heart and blood vessels, such as coronary artery disease, heart failure, arrhythmia, and heart attacks. Heart disease can develop over time and may not show symptoms until it's advanced. That's why recognizing the early warning signs is crucial to preventing severe complications, including a heart attack or stroke. In this video, we will explore 10 key symptoms that may indicate heart disease and explain what you should do if you experience them. Understanding these symptoms and seeking medical attention at the right time can significantly improve your chances of a healthier, longer life. Here are 10 common symptoms that could indicate heart disease. Number 1. Chest pain, angina. Chest pain, often described as a feeling of tightness, pressure, or squeezing in the chest, is one of the most common and obvious symptoms of heart disease. It may occur when the heart's blood supply is reduced due to blocked or narrowed arteries. This condition is called angina. There are two types of angina. Stable angina occurs during physical exertion or stress and typically resolves with rest. Unstable angina, more dangerous, occurring unpredictably, sometimes at rest and lasting longer. Unstable angina is a medical emergency and could indicate an impending heart attack. If you experience sudden or recurring chest pain that lasts longer than a few minutes or worsens with exertion, seek immediate medical attention. Number 2. Shortness of breath, dyspnea. Shortness of breath, or dyspnea, can be a sign of heart disease, especially if it occurs suddenly or with minimal physical activity. When the heart is not pumping efficiently, the lungs may not receive adequate oxygen-rich blood, leading to breathlessness. Conditions like heart failure and arrhythmias often cause this symptom. If you feel breathless even while sitting or lying down, it's essential to consult a doctor. Severe shortness of breath may indicate fluid buildup in the lungs, a hallmark of heart failure, and requires immediate attention. Number 3. Fatigue and weakness. Chronic fatigue and a general feeling of weakness can be early warning signs of heart disease, especially if these feelings occur unexpectedly or become more pronounced over time. If your heart is unable to pump blood efficiently, your body may not receive the oxygen it needs to function properly, leaving you feeling exhausted even after minimal exertion. Fatigue can be a symptom of various heart-related conditions, including heart failure, arrhythmia, and coronary artery disease. If you're frequently tired and find it difficult to perform everyday activities, it's crucial to discuss these symptoms with a healthcare provider. Number 4. Palpitations, irregular heartbeat. Palpitations are abnormal heart rhythms, often described as a racing, fluttering, or pounding heartbeat. These can be caused by arrhythmias, which are irregularities in the electrical impulses that control the heart's beat. Although occasional palpitations are common and can occur due to stress, caffeine, or exercise, persistent or severe palpitations that occur at rest or last for long periods may indicate an underlying heart condition. If palpitations are accompanied by dizziness, chest pain, or shortness of breath, immediate medical attention is necessary. Number 5. Swelling in the legs, ankles, and feet. Edema or swelling in the legs, ankles, and feet is another sign of heart disease, particularly heart failure. When the heart is unable to pump blood efficiently, fluid can accumulate in the lower parts of the body, causing noticeable swelling. This fluid buildup is often more noticeable at the end of the day, especially after standing or sitting for long periods. Swelling can also be caused by kidney or liver problems, so it's important to consult a doctor for a proper diagnosis. If the swelling is sudden, severe, or accompanied by shortness of breath, seek emergency medical care. Number 6. Dizziness and lightheadedness. Dizziness or lightheadedness may be linked to heart disease, especially if it occurs with exertion or when standing up suddenly. This can be a sign that the heart is not pumping blood effectively to the brain, leading to a drop in blood pressure and feelings of faintness. If you experience frequent dizziness, especially if it's accompanied by chest pain, nausea, or fainting, you should seek immediate medical evaluation. These symptoms may indicate an arrhythmia, low blood pressure, or heart failure. Number 7. Nausea and indigestion. Nausea, vomiting, and indigestion can be atypical symptoms of heart disease, especially in women. These digestive symptoms can be a result of poor circulation, which may cause discomfort in the upper abdomen. In some cases, nausea and indigestion may also occur as a result of heart attack or angina. If you experience these symptoms along with chest discomfort, sweating, or shortness of breath, it's critical to seek emergency medical care, as they could indicate a heart attack. Number 8. Cold sweat. Sweating excessively without any physical exertion, especially cold sweats, can be a sign of an impending heart attack. This may happen when the body goes into shock due to reduced blood flow or heart function. If you experience cold sweats along with chest pain, difficulty breathing, or nausea, seek medical attention immediately. Cold sweats combined with these symptoms should never be ignored, as they are serious signs of a heart attack or other heart condition. Number 9. Pain in the neck, jaw, or back. Pain or discomfort in the neck, jaw, shoulders, or back can sometimes signal a heart attack, especially in women. This is often referred to as referred pain, where discomfort originating in the heart radiates to other areas of the body. You may feel a sensation of pressure, aching, or heaviness, rather than sharp pain. If you experience any of these symptoms, along with chest discomfort, shortness of breath, or nausea, it's critical to treat it as a potential medical emergency and seek immediate care. Number 10. Coughing or wheezing. Persistent coughing or wheezing that does not improve, particularly if accompanied by pink or blood-tinged mucus, can be indicative of heart failure. When the heart is not pumping efficiently, fluid can accumulate in the lungs, leading to congestion, coughing, and wheezing. If you have a persistent cough along with shortness of breath, fatigue, and swelling, these symptoms could suggest heart failure and require urgent medical attention. What should you do if you experience these symptoms? If you experience any of these 10 symptoms, it's important not to ignore them. Many people delay seeking medical help due to fear, uncertainty, or the assumption that the symptoms will go away on their own. However, heart disease can progress quickly, and early intervention is key to improving your health outcomes. Here's what you should do. Consult a doctor. If you notice any of these symptoms, schedule an appointment with a healthcare provider as soon as possible. A thorough evaluation, including blood tests, an electrocardiogram, ECG, echocardiogram, or stress tests, can help determine the cause of your symptoms and the best course of treatment. Seek emergency care if symptoms are severe. If you experience symptoms like chest pain, shortness of breath, dizziness, or fainting, especially if they are sudden or severe, call 911 or visit the emergency room immediately. Time is critical when it comes to heart disease, and getting immediate care can save your life. Adopt a heart-healthy lifestyle. In addition to seeking medical care, adopting a heart-healthy lifestyle can help manage and prevent heart disease. This includes eating a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fat. Getting regular exercise such as walking, swimming, or strength training. Avoiding smoking and limiting alcohol intake. Managing stress through techniques like meditation or yoga. Getting enough sleep to allow your body to rest and recover. Heart disease is a serious and potentially life-threatening condition that requires early detection and timely intervention. Recognizing the warning signs, such as chest pain, shortness of breath, fatigue,